Do you need surgery for a herniated disc? Well, the answer is probably not what you think it is. If you come in and you see me and you have this set of symptoms, especially if you have multiple of them, then it starts to get a little more concerning. Having these, specifically having the numbness in your groin or your butt, or the loss of bowel or bladder control, may end up meaning that you have something called Cauda Equina Syndrome. And in this condition, some structure is severely compressing the bundle of nerves at the end of your spinal cord called the cauda equina. And this compression ends up preventing the nerves from doing their job properly, essentially. And so in this situation, when that's happening, what we want to do is get you to surgery as soon as we can, because if we don't, then we end up risking irreversible paralysis. But thankfully, that makes up very, very few cases, and really it's usually very obvious when that is present. So instead, let's go ahead and talk about how we handle the 99.9% of cases who do not have cauda equina. When you come and you walk into clinic with me, there are 4 big things that I'm looking at to decide if surgery is on the table for you. First one is, how long has your problem been going on? Second one is whether or not you have leg weakness or reduced weakened reflexes. The third one is, where is your pain located? Is it in your back? Is it in your leg? Or is it in both? And the fourth one is whether or not you've tried other treatments like physical therapy. We're going to go ahead and go one by one to explain why I care about each one. So the first thing is how long your problem has been going on. And the reason why this is important is because the vast majority of people that have a disc herniation actually get better over time, even without getting treatments. Now, it may surprise you, but the majority of disc herniations actually heal completely on their own. Now, don't get me wrong, you probably aren't going to feel great for a while this happens, but your body usually fixes itself, so we don't want to be overeager with surgery when we can heal on our own with minimal risk most of the time. In fact, research shows us that about 90% of people, so 9 out of every 10, with an acute disc herniation will get significantly better in 6 to 12 weeks, so 1.5 to 3 months essentially, without doing anything. So knowing this, it's kind of irresponsible, I would say, to do surgery if your problem just started 4 weeks ago. Because the research shows us that it will almost certainly shrink and get better on its own. And this means that unless there are red flags indicating cauda equina, or there's symptoms that we're about to talk about in a moment, then we will usually wait at least a few months before we consider surgery. Now, the second thing that we'll go look at is your neurologic status. And what I mean here is, do you have significant muscle weakness, or do you have reduced weakened reflexes? And if so, how quickly did that change happen? Now, why I want to look at this is that I'm looking for signs that your disc herniation is progressively damaging your nerves. Because if you suddenly notice a huge drop in your leg strength, like suddenly you find yourself where you can't lift your foot up, which you might know of as foot drop, or your knee reflex goes away, so I hit you on the knee and nothing moves, whereas before it used to, then that starts to get concerning. And if this is happening, what it tells me is that the nerve compression is severe. And in that case, if it's rapidly progressing, then we may want to go ahead and rush you to surgery to save the nerve function, which is why I care about how fast this change has happened. But a really important thing here is that we have to be careful to distinguish true muscle weakness from weakness due to pain inhibition. And what I mean by this is that often you feel weak because it hurts for you to move, but the thing I actually care about and what I'm looking for is the inability to move your muscle even if you try your absolute hardest. Because what I want to know is that your nerves are not functioning well enough to actually make your muscle contract. And this is different from you avoiding contracting the muscle because it hurts if you do so, because those are two very different things. Now let's go ahead and say that your problem has been going on for months and you have no major weakness. Now in this situation, the answer to whether or not surgery is appropriate comes down to question number 3, and number 4, which is where is your pain and have you tried other treatments? The reason why I want to know this is that spinal surgery for a herniation, which we call a microdiscectomy, is great for fixing one specific thing. And that one specific thing is leg pain, which you may know of as sciatica. However, it is notoriously very unreliable for fixing pain that is located in just your back itself. And here's why that is. If you have leg pain, so again, sciatica, it's usually because the herniation or whatever other structure is physically pushing down and pinching on your nerve. So in surgery, we go in and we remove a piece of that disc, bone, or whatever else it is that is pinching the nerve. And after that, since we've removed that thing pinching the nerve, then the leg pain or the sciatica usually goes away because we fixed the nerve compression. And this contrasts to if your main symptom is just deep, aching back pain, because in that case, surgery actually usually fails to make you better. And the reason is really extremely complicated, but the short version of it is just that the mechanisms leading to back pain are a lot more complicated than a simple 1 + 1 structural problem equals pain issue. With that said though, just having chronic leg pain alone doesn't qualify you for surgery, and honestly, insurance probably isn't going to pay for it quite yet either. The reason for that is because before we go to surgery, you need to have tried what is called conservative care. And this includes things like physical therapy, medications, and possibly even a steroid injection. The reason they want you to try all of those things first is that they are less invasive and less risky because, obviously spine surgery has pretty major risks, right? So what we want to do is we want to try them first in the majority of people, because all the research shows us that the majority of people will get better from those conservative measures. And so only after trying those things and still having back pain do we go ahead and look at actually booking an operating room for you. So as we come to the end of the video here, let's go ahead and summarize when surgery might be on the table. The first one is naturally that Cauda Equina Syndrome scenario that I mentioned, but that is very rare. Instead, here's the situation when we might actually pull the surgical trigger for most people. If you have, first, pain that has lasted longer than 12 weeks or 3 months. Second, if you have leg pain that is worse than the back pain. Third, if you have an MRI that matches your symptoms and identifies a clear target for surgery, like a herniation compressing on the affected nerve. And 4, you have failed, meaning not gotten better, with conservative care like physical therapy, steroids, etc. And you meet all of those criteria, then surgery may be an option. However, if you do not meet all 4, then it's unlikely that you will qualify for spine surgery for the reasons I just mentioned. And with that said, even if you do qualify for surgery, it's very, very important for you to know that surgery is not guaranteed to fix your pain or your problems. But realistically, that is a whole other video. Instead, just know that surgery is a last resort when nothing else is helping. So I hope this video made sense. I hope it answered your questions, and good luck with your recovery.